Good morning to all. This is the last part of the first aid which we've been speaking from the last 2 weeks. Now, this video is the remaining treatments which are required in first aid. As I said, we have six, I'm talking about the major six treatments. So, this is the last of it. I hope this video will guide you in the proper ability of treating it yourselves and your colleagues or friends. So have a good day. Cause further damage. In following up, limit physical activity. Only let him necessary physical activities to avoid and fully damage the bone. Now you have to avoid the person from doing any physical activities, okay, as it can cause the damage to the bone in a more major manner, which is irreparable. Then other treatments are there, like they put nuts and bolts and screws and things in the body, which is not very comfortable for the patient or for the person. So best option, avoid the person from making any movements. Let the person be calm. You can give a little bit activities where the person is not having to move around. Head injuries. Now talking about head injuries, it's a very common issue, right? When we say common issue is because kids are nowadays so careless, and your friends also, that they pull, push, run, fall, drop each other down, right? You'll do this. So in case of any emergency of somebody getting hurt on the head, what can be done? Let's talk about this. What to do right away? Check if your person is displaying any symptoms of severe head injury. This includes blurred vision, blurred vision or buried vision. Like, you can see everything hazy. So ask them whether they can see your 4 fingers. Ask them whether they can recognize things, right? This is one way you know whether the person is having a serious injury or not having a serious injury. Very first thing. This includes improvement balance of memory loss, right? In this way, you understand whether the person is having the proper memory. Otherwise, what happens? They may not be able to recognize the person. That means there's something dangerous happened, and it has to be taken care of immediately by sending the person to a hospital. The very first stage, that is to know whether the injury is a major injury or a mild injury. Now, looking for any open wounds. The second thing is, then you have to see for any open wounds, right? If there are any, wash the area with antiseptic liquids, like we said in the starting part, to wash your hands or whatever injuries are there with antiseptic liquids, right? Dilute with lukewarm water, right? You have to use lukewarm water. Why? Because lukewarm water can spread comfortably and clean the area out very well. And if there is excessive bleeding, apply pressure using a clean cloth to 10 to 15 minutes, right? So I said, if you remember, you have to press the area of it. If it's bleeding, press it so that the bleeding can reduce. And following up, check if the person is displaying any symptoms of severe head injury every 2 hours. If the cut is deep, take him to a hospital for stitches or further care. Like I said, if the person is having any dizziness or anything, any wrong symptoms of not able to recognize, as I said, it's a serious injury. Second thing is, if the wound is a deep wound and the bleeding is not stopping, take the person to a hospital so that the doctor can take care of the child or the person, whoever is having the serious injury. Last, the mind should be calm, approachable when such kind of issues take place. You cannot be in a hurry. As I said, people get worried and they run around trying to do things, but actually nothing happens. So always be calm so that you can think what you're doing. Okay. Ensure that the person is receiving adequate care, enough of care, right? The person should be getting enough of care, but also deal with an injury as you're dealing with an injury. So you also have to be very patient and very careful in such kind of situation, because if you take haste, then you can cause more trouble. Better be calm, better be understanding, and deal with the patient comfortably, because if you show panic, the person who is having the injury will get more worried and will cause more trouble for themselves. So I hope this video will bring a little bit more knowledge and understanding of injuries and first aid. Have a good day.